The Canadian Journal of Gastroenterology and Hepatology has found that in those with digestive symptoms, 30 to 50% of these people might have histamine intolerance. So we're thinking reflux, food reactivity, really of any sort, potentially also manifesting as loose bowels, bloating, distension, diarrhea, or constipation. Histamine intolerance might be what underlies that. Now, the hallmark of histamine intolerance, in my view anyway, is really reactivity to food, supplements, or the environment. But some common symptoms of histamine intolerance, or as it's also known, mast cell activation syndrome, could be neurological, being anxious, depressed, having poor memory, insomnia due to the impact on the autonomic nervous system, especially if you're noticing you are trying to go to sleep, but your heart rate seems like it's elevated. Skin reactions as hives, palpitations, even things like joint pain or bladder dysfunction might be driven ultimately by histamine intolerance. Again, think about that key hallmark of an excessive amount of reactivity to foods, to supplements, or to the environment. What I'd like to do today is walk you through, over the past 10 years, what I found to be the most effective protocol broken down into 4 steps, targeting diet, which has a sizable impact on histamine levels, the gut microbiota, which is crucially important because both local histamine production occurs there and metabolism of histamine. And then thirdly, natural agents for histamine or mast cell stabilization. And then fourthly, nutrient cofactors that help to boost the metabolism of histamine. And let's start with the really substantial impact that your gut has on histamine. The journal Gut has published that when one has a healthy microbiota, so the world of bacteria in your gut, you do not overly trigger the source of histamine, which are mast cells, immune cells. And when those immune cells, those mast cells are calm, you don't have secondary to that inflammation and damage to the gut. Therefore, the gut can release enzymes because the gut digests a number of things, including histamine. So the gut, when healthy, can then release the enzymes that metabolize histamine. So in a healthy individual, we have harmony between the gut microbiota, the immune system, the gut lining, and the release of enzymes that metabolize histamine. However, when there are symptoms, like we talked about a moment ago, there's usually some sort of imbalance. Dysbiosis, kind of a broad term, which could mean imbalances of the bacteria. And I would loosely include, along with this, overgrowth of bacteria, as in SIBO or small intestinal bacterial overgrowth, and even something like a fungal overgrowth as seen in Candida or SIFO, small intestinal fungal overgrowth. So when there's an imbalance in the gut present, this starts to cause the release of histamine and other inflammatory mediators to be released by that mast cell. And as you can imagine, this inflammation can start to cause dysfunction and damage to the lining of the gut, and therefore the enzymes that break down the histamine decrease. So it's kind of a perfect storm in the sense that imbalances in the microbiota or in the gut trigger histamine, the mast cells, inflammation, and thwarts through damage to the lining of the gut your ability to digest that histamine. Now, the good news is there's a lot that can be done to interrupt and to heal this cycle, but I wanted to take a moment to outline this because it's such a core, I guess pun intended there, component of healing histamine intolerance is improving the health of your gut. There's one other study I wanted to share with you that found carbohydrate malabsorption. So these are people who don't digest, let's say, dairy well, or just notice, boy, some carbs tend to flare me. It might be some other sort of carbohydrate malabsorption than just the lactose in milk. Malabsorption of carbohydrate and histamine intolerance are intertwined. So again, this concept of food reactivity as an indicator that histamine intolerance is present and therefore a doorway to remedying those intolerances is quite important, and again, why I wanted to share this with you. And so as we make our way to the 4-step protocol, I wanted to just quickly define that histamine, it's not bad. It's like so many things in biology, we need to have the appropriate level of histamine. No histamine will be a problem because it is an important signaling molecule of the immune system, which you need and you want to perform its housekeeping roles. However, when histamine becomes too high, this is when we start seeing all of these symptoms we outlined a moment ago. Now, sources of histamine include your diet, your microbiota, your gut health, and your immune system, like we've sort of been developing. And the target of this whole protocol is to ensure that histamine metabolism is exceeding that of histamine release. And if we achieve that, almost like the sink that can drain adequately, no water spills over onto the floor. If we can do the same thing with histamine levels, there won't be this spilling over of histamine into other tissues of the body or just systemically high histamine, and therefore we won't have all of these histamine-mediated symptoms. Okay, so again, the 4-step protocol involves diet, modulation of the gut microbiota, nutrients that are directly antihistamine or mast cell stabilizing, and then fourth and finally, nutrients that are cofactors to histamine metabolism. So let's go to the first component of this, diet. This is where a low histamine diet will be beneficial. People, if it's the right diet for the individual, will notice something usually within a few days, definitely within the first or second week of being on the diet. And as a few evidence points regarding, has this been researched? Do we know if this is efficacious? The answer is yes. First study, 2022, it's a small study, but nevertheless, 5 women with histamine intolerance were given a low histamine diet plus that DAO enzyme that the gut releases, but you can also take this as a supplement. At the end of the follow-up period, all of the participants had improvements in their symptoms. So pretty remarkable. And there was also a decrease in bacteria in the gut that release histamine. So a concept here is that the right diet will have a corrective effect on the gut microbiota. I want to be really careful to say the target shouldn't be, I did a lab test and I'm trying to just force down certain populations and force up others. The environment of the gut is too complex to micromanage. I said this way back in Healthy Gut, Healthy You, that you can't micromanage an ecosystem. But what we can do is intervene upstream, make the gut environment healthy. And then as a byproduct of that, many of these imbalances correct themselves. So first study on histamine intolerance, and I wanted to share just one more, a 2020 review. In this case, 13 various studies were summarized in cohorts given a 3 to 4 week low histamine diet. What they found was a efficacy of 33 up to 100%, which would make sense. No diet intervention is going to cure all things. So 33% saw improvement in some studies up through 100% in others. And there was a fairly uniform decrease in histamine levels, as you would expect. And then in some cases, there was actually an improvement in DAO. Remember that enzyme, because if a diet heals the gut releases that enzyme. And so just more and more information showing us that, yes, a low histamine diet can be helpful for histamine intolerance. I also just want to make a quick note here. As we discuss the diet, remember that it's not about bringing your histamine intake down to 0. You want to think about generally reducing, but if you're traveling, if there's a wedding, if there's a social function, you can have some high histamine foods. The difference between aiming for perfect and aiming for 80% compliance is fairly substantial in the sense that it's very, very difficult to adhere to a diet 100%, nor is it really clinically necessary. So the low histamine diet hallmarks are that it's going to cut out fermented foods, even though these foods can be healthy. It's going to cut out certain compounds that liberate histamine, like caffeine and alcohol. It's going to reduce common carbohydrate malabsorption triggers, like gluten and dairy. And it's going to remove foods that irritate the lining of the gut and therefore may thwart the ability of the gut to make that DAO enzyme that metabolizes histamine. So here's what the diet looks like in a little bit more detail. Vegetables. Vegetables to avoid would be spinach, tomato, eggplant, legumes, olives, and anything fermented, because the fermentation process will increase histamine. Now, it's not to say these foods are unhealthy, but like a rehab plan may have you avoid certain activity while you heal, and then you can go back to normal activity. That's the way to think about these foods. So instead of those vegetables, you can focus on fresh broccoli, cauliflower, kale, green beans, sweet potato, and cucumber. So there should be enough here for you to swap out the high histamine foods and generally replace with the lower histamine foods. Fruits also. The fruits to avoid that are higher histamine or liberate histamine would be avocado, citrus fruits, so things like oranges, banana, pineapple, strawberry, raspberry, and especially dried fruit is quite high in histamine. Now, conversely, you can focus on fresh, so non-dried, apples, pears, blueberries, watermelons, or watermelon, grape, and mango. And with grains, we want to avoid wheat, barley, rye, and sourdough, and instead focus on breads that are from rice, quinoa, millet, and oats. Regarding nuts, some nuts are higher in histamine, so we want to avoid walnuts, cashews, pistachios, almonds, and peanuts, and we can instead focus on the nuts and seeds of pecans, macadamia nuts, Brazil nuts, chia seeds, flax seeds, and pumpkin seeds. Again, all this within the framework and the agreement that you'll generally avoid the avoid column and focus on the safe. Does this mean that you can't ever have any avoid foods? No, you can have some of those sometimes. And I think the proteins offers a good example of a use case where we can build in some flexibility. So with proteins, we want to avoid, and this is something I learned the hard way, canned, cured, and smoked meats. So this would include jerky, bacon, sausage, lunch meat, hot dogs, pepperoni, and even things like canned or smoked fish, tuna, sardines. Again, it's not to say these aren't potentially nutrient rich, especially something like canned sardines. However, during this rehab plan, we want to be choosy. So choosy would mean that, let's say you're going to breakfast Sunday morning, you could have some bacon. You just don't want to be making bacon a staple you're having every morning. Again, the difference between these two in the doability of the diet in terms of are you going to be perfect, 100% adherent, or about 80% makes a big difference. Dairy, again, the fermented dairy we want to avoid due to the fact that it increases histamine levels. So you want to also avoid cow's milk, sour cream, buttermilk, aged or processed cheese. You can consume almond milk, coconut milk, or oat milk. Fats are generally okay. Drinks, you want to be careful again with the fermented kombuchas, alcohol, energy drinks, and black and green tea, and also mate should be avoided, whereas herbal teas and water are okay. So that is the rundown on the diet. Again, remember that this diet, you should notice something in many cases within the first few days. If by the end of the first or second week, this isn't helping, then it indicates that a low histamine diet is not necessary for you. And that's just important to recommend or to underscore because you don't want to continue forward with dietary restrictions that aren't helping you. This is how we end up in a syndrome of overly avoidant dieting. And we do have the more expansive handout that I'll link to in the description that will give you the food list in more detail. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health. So it is quite deeply appreciated. So that's the first and probably most important foundational step would be diet. The second step is modulation of the gut microbiota. This is key. Now, we are going to get some favorable modulation with the low histamine diet because any dietary intervention, my opinion here mostly, that improves host health, your symptoms, has a beneficial effect on the ecosystem of the microbiota. But there's a few further nuances we can integrate. The way I view the gut microbiota is it tends to skew in one of two directions toward bacterial overgrowth. So we're thinking dysbiosis or small intestinal bacterial overgrowth as in SIBO, or fungal overgrowth, thinking candida, thinking SIFO, small intestinal fungal overgrowth. This matters because the diets are different. Now, I also want to say, there's the foundational low histamine diet, and then there's a nuance of your gut type. Now, if we're in the paradigm of relaxed application of the diets, this is doable. Again, why I really want to underscore and emphasize these are general shifts you're making in your diet so you can sort of tune the dials and figure out what works well for you while also having enough freedom to feel that when you go out to eat or what have you, you're not confined by this really rigid set of rules. With the bacterial overtype gut, these are people who will notice lots of vegetables, lots of fiber tend to flare them, right? So broccoli, avocado, asparagus, people may notice a real aversion to these foods. And as one evidence point, a 2021 clinical trial concluded as follows. The low FODMAP diet, so this is the best diet for the bacterial overgrowth types, the low FODMAP diet also reduced mast cell activation in patients with IBS, reflected by decreased serum levels of mast cell tryptase and histamine. So the note you want to make is, have you noticed that if you go sort of lower carb, high fiber, high vegetable, are you noticing you're really prone to having negative reactions? If so, or if you have had a prior SIBO breath test positive, this is where integration of some reduction of FODMAPs along with the low histamine may really be a win for you. Again, within the framework of give it a 1 to 2 week trial. If it's helpful, carry forward what works. If it's not, don't worry about it. Now, the other way the gut can skew, instead of bacterial overgrowth, is fungal overgrowth. And this is where the diet's quite different. This is where reducing carbohydrates, some of which can be totally fine and healthy. I'm not claiming any of these foods to avoid are unhealthy. It's all about figuring out what the best rehab plan for you at this point in time is. But the starches, the rices, the potatoes, the squashes, the sugary fruits like pineapple, mango, even too much blueberry. If you've noticed that more carb-rich, so starches and sugars, flare you, you're probably a fungal overgrowth type. And you may do fine on the higher intake of vegetables, but it's really the carbs, the starches, the sugars that you want to be careful with. And we have a few data points demonstrating that candida or fungus stimulates mast cells. So we have a foundation of low histamine. And then if any of this gut type, bacterial or fungal, resonates, then you can make some additional fine attunements to your diet to eat for your gut type. Remembering again that this is not forever. This is the short-term rehab plan to heal, and then you should be able to, within months, start expanding your diet. The other component that is crucially important for healthy modulation of the gut microbiota, probiotics. We have fairly impressive evidence, meaning randomized control trials or better, demonstrating that probiotics can treat SIBO, candida, heal leaky gut, reduce inflammation, improve the gut-brain connection vis-a-vis the limbic system, and also to improve carbohydrate malabsorption. We certainly want to include probiotics. Now, there's some contention or confusion about probiotics and histamine. I wanted to share a 2022 meta-analysis of 28 randomized control trials that found a multi-strain probiotic, so not a special low histamine probiotic, just a good standard multi-strain probiotic, improved multiple histamine-mediated symptoms. Another study, this was in vitro, so we take with a small grain of salt, but nevertheless found that probiotics did not lead to a stimulation or a release of histamine. So collectively, the conclusion here should be that probiotics are net antihistamine. Now, as I mentioned earlier, one of the hallmarks of histamine intolerance or mast cell activation syndrome is reactivity to food supplements and the environment. So it is possible that someone may react negatively to a probiotic or any other supplement, even something as benign as vitamin D or a multivitamin. But it doesn't mean that it's because the probiotic is perturbing histamine. It's rather, I think, these unique idiosyncratic reactions that some people will have. And this is why in the probiotic protocol, we break out the probiotics into three different types so that you can personalize and listen to your body. There's the traditional blend of lactobacillus and bifidobacterium. Conversely, there's a healthy fungus, Saccharomyces boulardii or Saccharomyces cerevisiae. And then thirdly, there's a soil-based probiotic. Ideally, my view is use all three of these formulas together, but the exact reason why we break them out into the three different ones is in case someone notices a negative response to one of these, leave that one to the side and then continue on the one or two others that are neutral to beneficial. Again, as someone who works with a lot of sensitive people, it's exceedingly rare that someone does not tolerate any probiotics. Every once in a great while, you'll see that, but it's very, very rare. Maybe 3 people in an entire year. And most people will have some benefit from one of these. And again, because the probiotics will be antibacterial, anti-SIBO, antifungal, anti-leaky gut, we want to make sure to integrate this into our plan. The third step are the natural antihistamines or natural mast cell stabilizers. Why is it that we're putting these as the third step? It's because the gut is going to be so pivotal in metabolizing and correcting histamine intolerance that those two first steps are our foundation. But we can layer additional supports on top of this. Now, a 2023 review paper found the following had the best evidence regarding natural antihistamines: quercetin, resveratrol, curcumin, vitamin D, and benifuki. Benifuki is a green tea. You could also just use EGCG, which is the medicinal component here from the green tea. I also like luteolin and melatonin. So let's start with one other, or let's add to this one very interesting study looking at luteolin versus cromolyn and what impact these had on the mast cells. Cromolyn is a mast cell stabilizing medication. My perspective is I'm not a big fan of the medications. I don't refute they can help some people. They tend to have side effects in a decent number. So I like to leave the medications until the very, very end, last resort. Nevertheless, cromolyn is a commonly used mast cell stabilizing medication. They compared cromolyn to luteolin, and they found that luteolin was more effective in reducing histamine and mast cell activation than the drug cromolyn. In another study, again, this one, like the last one, are both in vitro. So a little bit of caution is warranted, but nevertheless, they found that melatonin reduced stimulation of the mast cells. And for those of you watching this, you can see in this image that when the mast cells were stimulated without pre-treatment with melatonin, you can literally see, due to the staining in this slide, a release of mast cells or from the mast cells. And in the cells that were pre-treated with melatonin, there's nearly zero stimulation and release from the mast cells. So this is why we have a number of these supplements codified into this protocol for you. Quercetin at anywhere between 500 to 1500 milligrams per day, resveratrol between 500 to 2000 milligrams per day, curcumin 500 to 1500 milligrams per day, vitamin D 5,000 to 10,000 IUs per day, benifuki, that green tea, 3 cups per day, or as EGCG, 200 to 400 milligrams per day, and luteolin, 100 to 500 milligrams per day, and melatonin, about 3 milligrams before bed. This is not an exhaustive list. There are many natural antihistamines. These are the ones that I feel have the best efficacy for helping to stabilize the mast cells and histamine. There's also some nutrients, and it's those nutrients I want to come to next that help with metabolism and are essentially cofactors for the digestion of histamine. And this next schematic from the journal Nutrients helps us to see how these vitamins will increase metabolism both in the gastrointestinal tract via being cofactors for DAO, or intracellularly for being cofactors for HNMT. What you're looking at here are copper, zinc, vitamin C, and vitamin B6 collectively will help with the metabolism of histamine. And in fact, one study, namely on vitamin C, found that 2,000 milligrams per day of vitamin C led to a 38% reduction in histamine. So a pretty impressive data point there. This is the nutrient protocol. Vitamin C, anywhere from 1,000 to 3,000 milligrams per day, keeping in mind that when vitamin C is too high for the individual, it can cause loose bowels. So I would add vitamin C by itself, slowly ramp up, and anywhere from 1,000 to 3,000 milligrams is fine. If at one of those dosages you notice loose bowels, back off the dose slightly. Copper at 1 to 3 milligrams per day. Vitamin B6, usually as P5P, between 70 and 200 milligrams per day. And zinc at 15 to 30 milligrams per day. By the way, none of these dosages are considered exorbitantly high. These are all fairly standard, reasonable dosages. What you're looking at in terms of the real world application, for most of these, anywhere between 1 and 4 capsules per day. For the zinc and for the P5P and for the copper, that's 1 capsule. For the vitamin C, it's anywhere between 2 and maybe 6 capsules per day to hit these dosages. So just to sort of call attention to, none of these doses are out of the ordinary. So those are our 4 components. I did want to quickly mention some other factors that if you do all of this and see some response, but you still plateau, let's say at 50%, 70%, 80%, and you feel like, gosh, I'm not all the way there. There are other things that you may want to consider. Firstly, you can supplement with the DAO enzyme directly. And for some people, this is helpful. There have been about 4 clinical trials that have demonstrated benefit from supplementing with that DAO enzyme. I tend to reserve that to late phase because if we improve gut health, we improve your internal release of DAO. So I like to see how someone does first, and then maybe after a few months, consider layering in the DAO. You could, theoretically, use it whenever you want. There's also a over-the-counter antihistamine protocol that many of the mast cell activation researchers tend to favor. This is where you will pair a H1 antagonist or blocker with an H2 antagonist or blocker. So you're thinking for the H1s, Zyrtec, Quercetin, your very typical sort of over-the-counter anti-allergy medications, and you'd pair this with an H2 blocker, something like Peptide or Zantac, that's typically used to lower acid levels. I should mention that histamine does trigger stomach acid. And this is actually, I think, a relevant aside, which is in the integrative functional and natural health space, there's a bias, at least in my opinion, toward everyone needing supplemental hydrochloric acid or stomach acid. This is true for some people, but it tends to not be true for those with histamine intolerance for this very reason, that high levels of histamine stimulate gastric acid or stomach acid release. Therefore, we don't want to be giving these people HCl. And if you're someone who's ran the experiment with HCl and felt nothing, or like your reflux or burning got exacerbated, it might be because histamine intolerance is actually giving you high levels of acid. There are some people who do have high levels of acid. There's some evidence that has demonstrated that the metabolism or the level of that DAO enzyme correlates with female hormones. So if you notice things like bloating, cramping, maybe even things like hives correlate with your cycle, then natural female hormone supports like black cohosh, dong quai, Vitex might be things to consider. I would give yourself some time on the 4 steps of the protocol first, and then if there's still some female hormone symptoms like irregular cycles, heavy flow, PMS, plus other symptoms that are more histamine mediated that you're worried about, that's when I would consider a trial on a natural herbal female hormone support. Stress. We know that stress will stimulate the release of histamine and the mast cells. So just something to bear in mind as best you can. Take some time to be parasympathetic or relaxed per day if you can. Would highly advise that. A walk in nature is a wonderful way to really calm down one's system, as is prayer, yoga, meditation, exercise, but just to make sure I speak to that. Environmental exposures is another. My perspective on this is as long as you don't suspect there's a frank issue in your environment, then I favor modulating the reactivity of the host so that they can thrive in somewhat normal environments. This is important because if the goal, again, is to, like with the perfect diet, is to have the perfect environment, that's extremely challenging. People should be able to tolerate a little bit of exposure to mold or fragrance or what have you, and not be really decimated by that. Because we can point to so many people who can tolerate those exposures. So I'm not saying those exposures are good and you want to weed them out as much as you can, yes. But if so many people can tolerate those, it tells us there's two components to this. There's the environment, and then there's the host terrain or the reactivity of the individual. So you do want to pay attention to the triggers, mitigate as best you can, but also you should have more freedom with your environmental tolerance if all of these things are executed correctly. There is a sneaky piece here, which involves either chronic infection or mold colonization. Now, with chronic infections, some of these can be in the gut, whether we want to call Candida and SIBO an infection, that's an issue of debate and maybe semantics, but also things like chronic viruses or chronic vector-borne infection like the Lyme family of bacteria. So these are all things, again, if you plateau, if you see some improvement from the 4-step protocol, but you plateau, these are things to investigate and then focus on treating to fruition. And with mold, I've recently, and a big credit to Dr. Andrew Campbell, who was on the podcast recently discussing mold, had my mind sort of reopened to the possibility of mold and mold colonization. And that's a longer conversation, but if you haven't heard the podcast discussion with myself and Dr. Andrew Campbell, I would highly recommend that if you suspect mold. The long short is, I think some of the thought leaders in mold are missing quite a few things, especially when you say, well, it's going to be at least 6 months until someone improves. In my view, that just violates every biological norm. If it's the right treatment protocol, like we've been discussing, results should be observable within the first few weeks or the first couple months. When someone says you'll need 6 months to 2 years to notice an improvement, which some of the mold community does, I think something is being missed, despite probably trying to help people. And this is where I feel Andrew Campbell has got his finger fairly well on the pulse of this. And then the final point would be certain medications. Certain medications will interfere with that DAO enzyme or with histamine metabolism. Example of a few of these are aspirin, ibuprofen, certain prokinetics, certain antibiotics like doxycycline and neomycin, certain antidepressants, MAO inhibitors, and amitriptyline. Amitriptyline can be used for IBS successfully at low doses. Does the low dose that helps IBS cause problems with histamine? I would be inclined to think that if you're doing all of these other factors from the 4-step plus protocol, that a low IBS dose of amitriptyline is probably fine, but nevertheless, to put this on your radar, certain anxiety medications and certain opioids. So something that I would speak with your doctor regarding. I would also say go through the 4 steps first. And if you're still plateaued, again, this is one of the things along with environmental, infectious, hormonal issues that you may want to consider, which is speaking with your doctor about a medication that might be hindering your response. That's the 4-step protocol plus a few thwarting factors. If you go through this, I am very confident at very least you'll improve and then have some more clarity on the next direction to investigate what might be thwarting you from getting the rest of the way toward that full resolution of symptoms. And I wanted to leave you with a quote: if you continually do hard things, you will have an easier life. And at first, making dietary changes or starting a new protocol may seem difficult, understandable, but take it one step at a time. And if you do this hard, hopefully not too hard, things, your life will get easier because you'll have better energy, better sleep, better skin, better mental clarity. And then you reinvest that back into your health, back into hobbies and family and friends and what have you. And if you're stuck, feel free to reach out to the clinic anytime. Myself and pretty much everyone on our clinical team has suffered with this to some extent. So both personally and clinically, it's something we have a lot of experience with and would love to help you if you get stuck. All right, guys, until next time.